we were late getting back to the airport, and so I was running or jogging to catch the airplane, and we missed the plane, and that was the onset of my heart attack. And I was pretty much afraid, I think, didn't know exactly what was happening, and like most 47-year-old people, I had 2 teenage daughters and a home mortgage and a wife, responsibilities at my job, and it just seemed like all of a sudden the rug was kind of being pulled out from underneath you, and didn't know exactly what the outcome was going to be. I chose UW based on the fact that they did have a cardiac program, a rehab program. And that helped me a lot because it gave me some information, I think, and knowledge to help myself, if you will. They were very helpful in explaining what was going on and potentially what treatments I might need and what lifestyle changes, and they didn't use the word diet, they used lifestyle changes. It is overwhelming initially. I don't think there's a good way around that, but I think with good education and I think with a willingness to feel better, I think that it's doable. They just kept, attaboy, John, keep going, things will get better, and they did. You know, in less than a month I was able to go 10 minutes on a treadmill and no problems, and I was pedaling bikes and airdynes and even doing a little rowing. It offered more positive reinforcement to make lifestyle changes, change my diet, quit smoking, and get some exercise so that I can do the right things to help my body stay healthy. It's not necessarily a cure, but it's a method and it's a way of living with the problem you've developed. And learning to live with it is, in my mind, what makes all the difference. And that doesn't happen overnight. It takes time.
He took me to the ER, and they threw me on the table and put the EKG on me, and I'm going, God, my back is killing me. I said, what's going on? They said, you're having a heart attack. And I said, nah, not possible. And he said, yeah, you're having a heart attack. Within 45 minutes, they had me up in the cath lab, and it was a 100% clot in the right coronary artery of my heart. And they put a stent in and then sent me to recovery. I was still trying to figure out, oh my God, I've had a heart attack, what does that mean? But the director came in and sat down on the bed in the hospital with my husband and I and brought these pamphlets and folders and kind of walked us through what would happen next as I went into rehab. And then I remember coming to rehab, read the materials so that before I came to my first appointment at rehab, I was concerned about the things I was eating, and so I brought labels from boxes and cans and things so that I could ask the nutritionist what I needed to do different, because I was scared. I knew I needed to make changes and I wanted to do it right. The program was tailored to what you had been through, what you were capable of, what you had been doing previously. They look at all that and they say, we need to start here and build gradually. So at whatever point you're at, they take you from there and move you forward. Well, the materials are very easily understood. They had written materials, they had videos, you could talk to people live, you had a group of people who all had different personalities and lifestyles who were doing it differently, so you could get different ideas. So I think all those different mediums kind of help. But then when you go back, you need the support of someone in your family or someone close to you. My husband was excellent because he was willing to do the dietary changes and the exercise changes and everything right along with me. So I think the motivation and support, you need to find some channel to help you keep motivated to do it. It was fun to see the progress and say, I don't know if that was because of the exercise or because of the nutrition or because of the pills. It was the combination of those, but man, there was a dramatic decrease in things that needed to be decreased, because it had to be something that was going to be long term. I mean, you can't just do it for a little while and then go back to your old ways. You have to build it into your lifestyle. You've survived, and this will get easier, because if you follow what they tell you in rehab and you do make some attempt to change your life by eating different, exercising, taking the medications, and doing the things that they say you should do, you actually can improve your health. In fact, you can feel better, and you can be hopeful that, you know, your life is going to continue and be good. I feel great.